Now you have to guess a little bit at the orbits because a lot of times they're in an oblique direction and you don't get a sharp line. Okay, we'll start over here.
それでは見ていただきます。
There's the border of the temporal bone and the
頭骨
mastoid
と
portion.
それから乳頭オブとの境目があります。
Clear into there.
はっきり
And it comes back in here.
こういう風になります。
Usually swings
ちょ
around.
っとこのように曲がりま
And
し
it
て、
comes into the suprameatal crest. This crest comes down here.
挟んできます。
Terminates in
こ
the
こで
zygomatic
終わり
arch.
ます。で、
Here is the
次
orbit.
オービット、オルビ
I
タ
can
ー
see this much of
で、
it.
ここま
A
で
few places are missing.
で、
I can look in here and
ここ
see
にありますものは、
the superior and then the inferior orbital fissure. Right lateral to the junction of those two is the foramen rotundum.
で、
And I can see the one over on the other
反
side.
対
Coming right off of this zygomatic arch
ここは
is the
胸骨
articular
球ですが、
tubercle. And this then is the articular eminence.
え
This terminates
関節隆起が終わるところがこ
in
こ。
the spinous process of the sphenoid, okay? All right. Now, if you notice, if this is the articular eminence,
関節隆起です。
in back of it
その後ろにあるのが、
is the depth of the fossa.
その
All right.
深
That
みの
means
ところ
then
で
that
す。
the condyle is sitting
と
in
いうこと
between
は、
the two
コ
of them.
ンダイルがここに挟まっているということになりま
If
す。
you look carefully, you can see it.
丁寧に見るとわかります。
This right here is the cornoid, going over to the mylohyoid. Comes down there, and
こう
there's
いう
the
形に
fovea.
なりまして、これがフォビアです。
All right. Coming down here, you see
こ
a
の下にありますものは、
heavy line,
はっきりとした線で見えますが、
and that then is
これは
the external oblique ridge coming down and coming
外斜
down
線
into the mandible. So we can go ahead and go over to the other side. There's the orbit. Coming in from the side then
この横から入ってきているもの
are the petrous portions of the bone. Right here is the small wing of the
ここにあ
sphenoid.
ります。
You just barely see the crista galli.
それか
When we
ら
trace the nasal
頭蓋
cavity,
底管です。
we try to pick up the
その
widest
下
part of the inside.
一
And
番
this is a nice straight septum. If you look very carefully, you can see the
よく見ますと、
mid-maxillary suture. Coming around here,
こちら
you see the two parts
こういうふうになってますが、線を引き
where you
ます。
see a crossing of the tuberosity.
これ
Now let's get this other joint.
こちらまでは書いておきます。
Now essentially we've got everything that we need here. You can see this is in the frontal
これは
lobe of the brain. You'll see how it comes down like
前
so.
頭葉に当たるところ
You
です。
see a tiny little line
それ
right
ちょっとここ
here.
に薄くなってますが、線があります。
What is that? That's the great wing of the sphenoid,
長
separating
頸
here
骨
the
の大翼で
infratemporal
あり
temporal
まして
fossa. Now here's where the template really helps. Usually what I do is to go in and find the
まず
teeth
最初にこうシガを書いていく
and
ん
put
で
a
す
little
ね。
dot for the
Siga
apex of the root, apex of the crown. Okay. Now let's trace the lowers first. And so right there is the lower central.
まず中接歯です。
Now we'll trace the two uppers. Something you can trace very quickly like so.
こういうふうにす
Now
る
she's
こ
got
と。
a spacing between the two upper centrals.
上顎の
Right here you can see the two laterals, which are displaced lingually.
から、
This lateral is quite lingual.
これも
Okay? Now we can find the two upper canines,
今度は上顎の3番。
and they're rotated forward. So sometimes you almost have to trace those
ですから、このようにして書いておく。
in this way.
これがそうです。
Right, now this upper second
これは
is facing
7番
distally.
なんです
This one's not quite as distal as the other one.
こちらそれほど遠心にはずれていません。
So there's the second one. Now let's go down here to the lower arch.
科学はどうでしょう。
This looks like I can use the template on it.
でこれでテンプレートで書いてもいいですね。
Probably this one too.
これもそうですね。
It's about the surface there. Like that. This premolar is there. Now these look like they're from the front. See, because they're turned around, remember? So I can use the frontal to trace that one. And use the frontal to trace that one. See? Because they're turned around like they'd be seen sideways. All right, now here's the second molar.
これ7番。
Now, what am I looking at right here? I see something right here. That's the two sides of the first cervical vertebra. Now that I got the teeth selected, I can come in and draw the palate. In the middle of that would be the internasal spine. This rolls in the Now, we'll take these and we'll use them to do our analysis on. Don't forget to write the name. Now, we employ essentially three planes, represented by the blue,
青で示す平面。
which is basion to nasion.
これはベジオン、ラジオンです。
This is called the basicranial axis.
これに
We use basion as the center of the occipital bone, nasion as the anterior landmark of the cranial base. Now that represents a whole plane. Usually a line connects 2 points. A plane is a whole surface, three-dimensional.
3
So really we do think of that as a section between the base of the skull and the face. Now the Frankfurt plane is something that won't go away. For 100 years since it was invented, people have tried to put it down. But just like the friendly dog, after you kick it, it comes back and licks your hand. But we insist that it is selected by visualization and not the ear rod of the cephalometer. The top of the condyle precisely on the Frankfurt plane. In class 3s, it might be above it. In some class 2s, it's below it. But in normal situations, the condyle is just about on the Frankfurt plane, on the red line. And of course, it's made by the orbitale and chorion.
これを
So it's a plane that is used quite commonly to describe the face because it makes a nice horizontal for a coordinate. Along in the 1952 or 3,
1952から3年にかけて
I began to notice with extraoral traction that I was changing the position of the maxilla. Brody had suggested that we use the pterygopalatine area and the pterygomaxillary fissure, which is this line here.
でブロディ
But I found with orthodontic treatment that this was being pushed back. So in seeking a point that wouldn't change, I started using the back end of the root of the pterygoid plate, or the front end of the root and the back end of the pterygopalatine fossa, as PR point. The two plates come down. Those are the roots of the plates.
になる
What I call the pterygoid reference. Since this was the root of the pterygoid plates, I called it the pterygoid root vertical,
でこれ
or PTV.
それが PTV と
That was one of my inventions.
これは
Now those are the three basic planes.
以上
Maybe this method, devised by Tom Christie, one of my students,
このこれ
might be the most appropriate way to go from now on. So let's go ahead and use this technique to get side point and draw a line like so. This line then is 45 millimeters
今
long.
45
A half of 45 is 22 and a half. So right there's the xi
でこれ
point.
を在
The old way was the same way here. And what I would do then would be, this would be 42 down a little bit and forward just a tiny bit. And there's nothing etched in stone, anything I do, you know. Let's draw the facial plane. Draw the mandibular plane,
これマンディビュラープレーン
the way we do it.
いつもの
Now we'll draw a facial axis from PT. The facial plane and mandibular plane gives us a point here
フェイシャ
to
ルプレーン
draw cephalometric nathion. Now we go from PM
PM
through xi.
とても綺麗ですけど
This is PM, this is PO,
PM、
this is
PO、
GM, this is menton,
GM.
subgonion.
メント、サブゴニ
Xi
オ
point.
ン、在点
DC is right here at the crossing at the basion-nasion plane. I don't use it anymore. Draw the palatal plane. Draw a line from CC
CC からラインを描きます
to point A.
A 点まで引きます
Draw a line
線を入れて
from nasion to point A.
ラジオンから A 点まで
That's the nasal plane.
This condylar axis, this axis passes through xi and where? The way you drew
Center
it
of the
now.
condyle. The center
Xi
of the
と
head of the condyle. Most
Center.
upward and backward point on the
So
condyle.
it's not DC xi.
No, we don't use D.
違います
No.
DC を
I
使い
take
ま
it all
せ
the
ん
way through now.
もう全
But for forecasting, it's best to trace the condyle.
で
It's
も
no harder to trace than a tooth. No harder to locate than the right and left sides of the teeth. So we do that all the time.
遅く
Do the occlusal plane with the buccal occlusion. Draw the occlusal plane through the deciduous molars or the premolars
New
and the
Diacusica.
first molar. We call that the true buccal plane. Now the reason for it becomes obvious when you have a deep bite.
なぜこうい
In a
うか
class 2 division 1, these teeth are caught and pushed out like so.
この
And the lower incisors are pushed upward and backward into a deep bite.
で
So the plane of reference for the correction is the buccal occlusal plane.
下が
Now, draw the APO plane.
AP
These are references for the teeth
これが
together with the pterygoid vertical. So these are See if you can find the zygomatical frontal sutures right
胸
here.
骨前頭保護
The center of the zygomatic arch.
ザイゴマティックアーチ胸骨球のセンターを使います
We use that as ZA. Please keep in mind that this is on the inside of the orbit. See if you can find Crista Galli, CG.
していってくださ
If you have symmetry in the face, those two lines should be parallel. If you have to make a choice, use the zygomatic arch because that's the frontal Frankfurt plane.
いレーシングで今日やったのとはまた
So
違
we'll
い
take
ま
the
す
center of that
こ
and
の
the
セン
center
タ
of
ーとこ
that,
のセンタ
and we'll draw a horizontal through these.
ーで水平線を引きます
And then we'll find that one. Those are reasonably parallel. Find the Crista Galli, and if you can't find Crista Galli, use the topmost part of the septum
微中
to that. And now you can see whether or not you have symmetry in the face. Right at this time, while we're drawing parallel lines,
今
Find your points of reference here.
基準点、レファレンスポイントを見つけます。
The bisection of the molar occlusion and the floor of the nose.
それから鼻腔点。
Okay, now draw lines between those points that you have.
でこの入れた点の間、線を引きます。
Without looking very far, you see you have awful good symmetry in this face, horizontally and transversely. So without any measurement at all,
全く
just view it and you see whether or not you got symmetry. If the chin's off to one side, or these are not parallel,
この
or
線が
reasonably parallel,
かなり
and
平行
if you do, then go back and maybe you made a little tracing
なけ
error.
れば、
So go back and view and see if you didn't make a tracing error. You connect Z to AG. Z to AG.
Z と A。
And that gives you a reference line then, which is the frontal facial plane.
これはフロント
Like we would draw something from nasion to pogonion, now we draw it from the zygomatical frontal suture down to AG point. So this is going to be a reference line through here.
以前は
One of the other measurements that I think that we should use
もう一つ
is a line from the ZA point
これは ZA 点と
down to the AG point.
AG 点を結ぶ線です。
And that's another way to measure asymmetry. Now, if this angle here is different from that angle there, it's the difference between the two angles.
この2つの
If the
角
two
度が
angles are not the same,
違っていたら一致しなかっ
one's
たら
bigger than the other,
片方の方が片方よりも大きかったら
then the mandible
それ
might
す
be
なわち価格が
like in a crossbite.
ちょうどクロスバイトみたいな状態になっていて
The mandible is shifted to
パ
one
ーツが
side.
どっちか
Yes, so you've already connected J to J.
もうすでに J と J を結んであります。
And what you can do then is to box out the nasal cavity just to look at it. Actually, your parallel line would have been off here because this nose is up on this side and there's a deviated
これ
section.
は離れますので
So what we do now is to draw a line from J to AG.
J から
So we call that the jag line.
今度はジャグラインです。これは JAG ですから
Like jaguar.
ジャガーみたいなジャグです。
I've had 3 of them.
もう今まで3台ジャガー乗りました。
My
持ってま
wife
す。
made me sell them all.
ワイフに言われて全部売らされてしまいまし
But I might get another one.
た。もう一台。
So this is J.
これが J です。
This is AG.
AG。
Okay. Now we're going to use this as a reference to measure relative positions of the teeth.
これ
So we're going to measure the lower molar perpendicular to that line.
科学
The reason that we make tracings is so that we can be critical, scientific, can measure, and can superimpose later. We have to look at cephalometrics as a whole now. Now what do we want to do with this device, with this tool, with this technique? Several years ago when I went to California in 1952-53, I made friends with a lot of orthodontists. So one day I was in San Francisco at a meeting, and we had gone to one of the fancy restaurants there in San Francisco.
そこで
There were 5 couples. Most orthodontists are not really intellectual. And one of the people that I had known that was a member of the Tweet Society said, "Okay, Rick,
で彼が言うには
here we are, we're drinking beer together.
まあビールなどを飲んで話してたんですが
Don't give me any guff. Don't give me any nonsense.
もうその
Really now, in truth, tell me, what you can do with cephalometrics that we can't see on a photograph or in a set of models. When I went to California in 1952, there was only 6 cephalometers in the whole state.
で、
It took me a little while to precipitate.
まあ
I have a lot more knowledge about the nature of a face and the nature of a malocclusion than you do.
ですからあなたよりはたくさん知ってると思うと言い始めたんです。
I have a lot more sophistication about what an appliance will do
つま
than you
り
can tell on a set of casts. I have a lot better way of showing a patient the nature of the problem and what I'm going to do about it. I have a lot better way of educating myself and learning from others,
また他の
and I have a way of educating the patient. Now that question prompted me to go and measure the first 1,000 patients that I had. And I published that article 31 years ago. I called it the Foundation for Cephalometric Communication.
言葉って言いましょう。4つの C があって
The first was characterization of the patient,
まずですね
which
患者の
means
その
morphologic description. Okay? Morphologic description. What we're doing is describing the anatomy. We call it an analysis or a survey,
あるいは
but in fact all it is description.
え
And that is the basic starting point.
この
Now from that, we have to make an interpretation. And therefore the second C is to classify.
で
Major and minor classification. We don't just classify the malocclusion, we classify the face.
つま
We might even classify the base of the skull.
り
So that is the second part of it.
でこれ
Now the third part was a comparison. This means longitudinal or serial,
で
with and without treatment. Because in essence, it is nothing more than measuring change. And we have to select points that we think are changing least, or can be a frame of reference from which we can measure the differences between one person and another. So by comparing, we're comparing the patient to himself at a later time. Now the final C then was communication.
こう
Today I would put another one on there. We use the tool for comprehensive planning.
し
Anybody can plan a case, but to be comprehensive,
ただ科学的
knowledgeable,
あるいは逆した計画
exact,
あるいは
specific,
正確で
and be deliberate
であるいはそれは
in our plans. You have to be comprehensive.
始めるわけです
This is the tool I'm going to use to teach you orthodontics
でこ
so that you'll understand it.
でなら
So cephalometrics is my orthodontic language. And if I'm going to talk to you and you're going to talk to me, you've got to use this language. And what we have with this tool is really a shorthand method
ですからこ
of description of change
で
and a tool for communication.
そして
So in essence, that's where it is. Now in the beginning,
当初は
as Broadbent and Brody and Bjork, it was only a tool to measure change.
そ
It
の
was not to be used for description, for diagnosis.
あるいは診
It was not to be used for forecasting.
あるいは
It was not to be used for treatment planning. Only a research tool to measure growth.
要
The
する
first breakthrough with its use for clinical use was done by Downs. And I was trained by Downs. And I was compelled to make the changes that you have witnessed since you've been here. The next breakthrough was Steiner. And Steiner must be given credit for selling it to the clinician. He was a very dear friend. In fact is, he asked me to practice with him.
で
And I did.
あの
How long did I work for him?
何年ぐらい一緒にいたでしょうか
One day.
1年
So he asked me to come work with him, and I said, fine, Cecil. So I went over and started working
で仕事をし始めま
on
した
his
が
patients. And I started asking him questions.
いろいろ聞いてみたんです
Not to be obnoxious,
まあその悪
because
が来た
I
というわ
wanted
け
to
ではあ
work
り
for
ませ
him.
ん
I really did. I
あ
wanted
の
to work
私
with him.
全く悪が
So at 4 o'clock in the afternoon, he looked at me and I looked at him.
お互いに顔見合わせて
He said, this isn't going to work, is it?
もう
Afraid not, Cecil.
だからそれでまあ終わりになったわけでありますが
Well, you go ahead and start your practice out in the Palisades. I'll send you some patients.
で
So he sent me one.
で何人か一人から
He was a cleft palate,
口外ですね。
with an ankylosed lower first molar. And he'd been watching this kid for a long time. And he says, Rick, he says, I don't know what to do with this. It's all yours. Same thing happened to me with Brody. I went in to see Brody when I was doing my work at school. I'd gotten married and had a baby. And my salary was $1,500 a year. It's $125 a month. And have a wife and a child. So I went in to see him one day. I said, Dr. Brody, I'm starving. Literally, I don't have enough money to buy food. Now, it's not very much, but would it be possible for me to take a couple patients down in the cleft palate clinic? He said, we have no intramural practicing in this institution. But he said, if you do take a patient, don't ever tell me. So he sent me one. The first patient, a surgical class 3. I've got her records here. She was a great big Italian girl. She had 16 cavities and 6 missing teeth. And that was my first patient. So I took that patient, and the first thing I did was to change her diet. Every morning and every afternoon, in the middle of the afternoon, they had a cart of goodies that would come in. And so she would have pie in the middle of the day, Cokes, candy. We did a subcondylar osteotomy. Went through here and passed a wire around the neck of the condyle, pulled through a saw, and cut the condyle here and cut the condyle over here, and I moved the mandible back. But that was the first surgical treatment objective ever made that I know of. I set the whole thing up on paper. I used Cephalometrics to plan the treatment all the way through. So Cephalometrics is a planning tool, and I think I was the first person to start using the tool as a specific planning tool. Let's start looking at numbers, not that they're sacred, but only toward reaching an understanding. Now we're going to discuss each one of these so-called parameters. You just have to trust me.
だからもう私の言葉を額面通り受け取っていただくしかないんですけども。
That these are the best that I could find. They're as good or better than any other thing that I could use to measure what I wanted to measure. Now today I would go what I call around the horn. All right. We're going to start out by measuring the intersection of the corpus axis with basionasion as a very important thing because it is fairly predictive. In the population, that is a 60-degree angle plus or minus 3. The average face is 60 degrees. So very simply, if this angle is open, you've got a long face.
このアングルが開けば長眼になります。
If it's closed, you've got a short face.
鋭角になれば短眼になります。
So we use this as a representative of total facial height.